everyone. My name's Katie McClure. I'm the current chair of BCS Health and Care Scotland, and delighted to have Chris Mackie with us here today. He is the Digital Director at Health and Social Care Alliance Scotland, and he wants to talk to us about all things digital health and social care at the Alliance. And I know that's a topic everybody's fond of, and I always love to hear about updates to ALISS. And just to say thank you to Chris Hoy for suggesting we have Chris Mackie along to speak. We're delighted that's worked out. And I'm just going to hand over to Chris now. And please post your questions in the chat and we'll ask Chris at the end. So Chris, over to you.
Super. Thanks, Katie. Yeah, good evening, everyone. Blue skies here in Glasgow as well. So again, yes, if only we can do Zoom calls from outside, but no, I don't think that's for the best in this occasion. So I'm just going to share my slides. So yeah, I've got the title, All Things Digital Health and Social Care at the Alliance. So I'm the Director of Digital at the Alliance, and so essentially I'm going to run you through what we're doing on the digital side. But first, a few words about the Alliance itself, just so that people are aware. So first of all, there's our vision, where everyone in Scotland has a strong voice and enjoys their right to live well with dignity and respect. So the Alliance is an interesting organisation in that it is what's called a third sector intermediary. So in other words, we sit between government and the third sector, we sit between Scottish Government and a large membership, which includes individuals, so disabled people, people living with long-term conditions, unpaid carers. And it says they're third sector organisations, but it's anyone in the health and social care space can be a member. But our particular focus is on the third sector. And we have a number of programmes of work. Now, I was looking at this earlier and I was wondering if this is entirely up to date, but you can see the range of work that we do. Humans of Scotland, for example, is a project aiming to tell people stories, people who are affected by long-term conditions or caring responsibilities or disability, or people working in that space. We've published a number of books, publications, telling people stories. We have various networks of relating to different conditions. So there's a heart disease network, there's a long COVID network. We have a significant policy function. We have a self-management team, and we administer a £2 million self-management fund on behalf of government. So that's funds that we disperse to the third sector, all in the name of self-management. And you could probably have an hour from that programme alone, if not all of these programmes. In the community, and I'll refer to this later, in the community we have a significant link worker programme which works across Glasgow and West Bartonshire, which is working directly with individuals engaged with deep end GP practices in the most deprived areas of Glasgow and West Bartonshire. So we could talk at length about these other programmes, but what we're here to talk about today is digital. So without further ado, I'll just run through quickly the different programmes within the digital hub, as we call it, which I oversee at the Alliance. So first of all, ALISS. ALISS is a local information system for Scotland, and I'll be talking probably for the majority of this presentation about ALISS. And I know that, as Katie mentioned, Christine Hoy's on the call, and you know I was just chatting previously about the Derek Hoy Memorial Lecture last week, and Derek was obviously instrumental in the creation of ALISS, dating back 14 years now, since its inception, although I guess the ideas must have been generated prior to that, but certainly in the digital world, quite a mature programme of work now funded by government. So these other ones, I'll explain later what they're all about. Discover Digital, promotion of digital health and care tools. Digital Citizen Panel, which is a forum for individuals' voices to be heard by government about digital innovations. Digital Links Project, which is a new piece of work linking digital inclusion with the Links programme that I just spoke about. And then all of this is really underpinned by work on human rights principles in digital health and social care. And that's a piece of work that we've had going for the past 3-ish years, working with Scottish Care and Vox Scotland. So we'll talk through those principles as well as part of the presentation. So you'll hear a bit about that later on. But we'll move to ALISS first. And if you're not aware, ALISS is a local information system for Scotland, helping people to find and share information about community assets and services that support health and well-being. So, and that's very much in the digital space. We're using technology to get that information out to people. But as you'll see, a large part of the programme is about engaging with communities, and so the programme largely divides into two, where there's the sort of technical aspects of it, which we'll touch on, and the people aspects of it. And what I will do, just because when we're talking about the scope of the programme, when we talk about health and wellbeing, what do we mean by that? Because it's much wider than the scope of the Alliance as a health and social care organisation. Health and wellbeing stretches much beyond those boundaries. So we quite often quote this definition from the World Health Organization, and so when we're talking about health and particularly well-being, we're not just talking about what happens within the NHS. We're talking about what happens in communities, and you'll see some of the sort of different organisations and services that you can find on ALISS, walking groups, yoga, open mic nights, these types of things. Lots of broad-ranging activities that are available in communities. And what we're trying to do is collect that information and make it available to people. So what we're aiming to do, I suppose, is to answer the question, what keeps you well? And that's what we're asking really when we engage with communities, because we're trying to get people to think creatively about what keeps people well. So it is about those local activities that might happen in the local park or the library or the community centre, not just the formal services. So we're scoping out organisations that might only be one person, or it might also be some of the bigger charities and the different services that they operate. We're thinking about digital tools now. We're talking about helplines and these kind of things. And, often you hear about the barriers to accessing information. That word of mouth is often the preferred method. But, what if you're isolated and lonely? What if, you don't know where to turn to? And so what we're trying to provide is a national repository for information. And what we're aiming to do is to provide a kind of once for Scotland approach to this, acknowledging that lots of mapping is done, and what we're trying to do is coalesce that mapping around ALISS. But that's challenging because everyone's got a little scrap of paper somewhere, or an Excel spreadsheet on your desktop, or lots of areas do have their own websites that they're running, mapping out services, and that's fine for people in those local areas. But what we're trying to do is look across Scotland, because often people don't respect those local authority boundaries. For example, they're wanting to access services, they're wanting to access things that will help them live well, and they don't really bother so much about whether they're in Glasgow or Western Bartonshire, for example, that those boundaries are created and sort of imposed on people. So a local information system for Scotland is looking right across the country, and we're There's lots of national resources there as well, which you can find. And I'll show you some screenshots of just a search that I did earlier around that. So just going through some of the different types of resources that are on there. Those enabling social connection, so your befriending services, your peer support groups, these kind of things. Helping people manage, self-manage long-term conditions. So there's condition-specific helplines, support groups for people to come together, whether that's in person or virtually. Outdoors physical activity is really big, and so there's lots of things like walking groups, and particularly in the horticultural space as well. We've been quite active in getting, reaching out and trying to get lots of those kind of services on there. And then things like money advice, which is often required, and then things like advocacy services as well to help with the practical things. And then linking to Discover Digital, which I'll talk about later, online digital apps, tools, websites, resources, and we've also seen the likes of what they're calling digital hubs. So places where you can go and access technology or an internet connection if you don't have that at home. So these types of things we can list on ALISS, because digital health and social care is a very active and growing field. So some of the principles of ALISS. So yeah, we've got quite a few of them actually. So open source, open data, crowdsourced, co-produced, and agile. Lots of jargon there. But I suppose that what we're trying to do is work in the open. We're trying to say that what we're doing is you can learn from. You can look at the code if you want on GitHub, and there are various ways you could potentially take what we've done in ALISS and use it in your own situation. So we've offered that to people out with Scotland, and folk can learn about what we've done by looking at the source code for the technical people. From the open data point of view, I think that's really interesting, because what that enables is the fact that the data can go to different places. So very simple example of that is that you can go to aliss.org, you can find stuff on there. But you can also go to NHS Inform Scotland Service Directory and find ALISS data there. You can go to other websites. There are social prescribing software tools that use ALISS data. So all via our open APIs. And you can find links to all this via the footer on the aliss.org website. Crowdsourcing is a major factor in our major feature of the work that we do, because we are not, we're a small team working within the Alliance. We do not know what's going on in every community across Scotland. What we do know is that we can publicise ALISS, we can promote it, we can train people to use it, and they can put their information on there. So information they're aware of, or information that's about a service that they're running. So we're encouraging people to put their own information on there and take control of it via what we call a claiming process. And we've done quite a bit of work in enhancing that recently, which I'll note when we see some screenshots later on. ALISS is co-produced, and this has been a principle right from the start. So back in 2010, when things started off, there was extensive co-production work done with people, and we've carried that forward right through to the present day, with very user-centric design processes. And we've had a few user researchers on the team, and we currently have a full-time service designer working on the ALISS programme, who's doing all that good stuff around putting people at the centre, which is really one of the mantras of the Alliance. And finally, that word agile. So I guess that means we're never going to be finished. We're always going to be improving things. And, you know, it's one of those things that we make improvements to the site, and people, you know, suggest things, and we design things with people, and we make changes to the site. And then sometimes people go, oh, it's too confusing now, but it's just all the functionality that people have asked for, you know. So what you're trying to do, I suppose, with something like ALISS, and a lot of public services, this would be true. You're trying to do something quite complicated, but make it really simple, make it really accessible. You know, from a language point of view, from you know, a disability point of view. So for screen readers, for example, we want to make sure the site can be read easily by that means. But also we want our language to be simple. We want, you know, the accessibility tools. We're using a thing called ReachDeck, which means you can translate the site, you can change the contrast on the site, you can do all sorts of things. You can have it read out to you if you want. So there's always work to do, and you can never really say that you've finished it from, I guess, a design and technology point of view, but also from the data point of view, because there's always things shutting down, there's always things opening up, there's always people changing their phone numbers and their email addresses. So the data needs to be constantly maintained. So that's a real challenge. So we move on. I'm just having a wee look at the time because I could rabbit on about ALISS all day. So this is the current front page on ALISS. So you can see some of the stuff that I've been talking about, accessibility at the top there, and then the ability to add information to ALISS, the ability to register an account and log in and you know, that sort of thing as well. So we're not going to look at the back end unless people are desperate to see it, but I'm just going to show you some simple functionality from the front end, whereby we are searching for Bishopbriggs. So there's two avenues here. There's the where and there's the what. You can go in either route, and we have many debates about this, but what's the best way to, you know, default. But at present we default to location. So I'm in Bishopbriggs, so I've put a Bishopbriggs postcode in. So that's what happens, and you can scroll down much like you would on Google with lots of different search results. So you can see filters on the left-hand side. You can see the results that have come up, and yeah, I've actually typed in the keyword mental health as well there. So that's why these particular resources have come up, particularly that CAMS one at the top there. Now, thinking about the data quality issue, what we're doing now is we are focusing on resources that have been updated in the last 12 months. So you're only seeing part of the story here, but you're seeing these first three entries. They're all got 2024 last updated dates, which is what we want. We want to have eyes on things as regularly as possible to give people confidence in what they're seeing. And then you can see that claimed logo as well that's appearing there against the walking groups, and then this Serenity Mind Body Soul. So essentially what's happening there is that the people responsible for those services have clicked to claim, and they're the only ones that can update that information. So what we're saying to the user is that there's a direct link between that entry and the service. It's just because sometimes people put things on behalf of others, and that's great that they've done that. But what we're saying with claiming is that it gives you more of a reassurance about the entry there. But it's something we're seeking to improve at all times, that kind of trust in the entries, and the fact that people, you know, if you phone it up, the number's going to work, someone's going to answer it, or if you go along to the service, there's going to be something there approaching what you've seen on ALISS. So yeah, so that is when we go into a particular entry. Now I picked the Nemo Arts guitar group because I play the guitar, and it's got a nice illustration of the map. So what you can see there is there's a pin in that map right at the centre of Glasgow where that group meets, and we can see a little bit about the service. It's every Wednesday, Thursday, 12 till 2 p.m. And so you can see who provides the service, which is this Nemo Arts. You can see the last updated date, and you can see some contact details about it. So that is just a quick illustration of a wee ALISS search. The next slide illustrates, I suppose, what I was talking about earlier about open data. So the data is going to different places here. So you can see NHS Inform, you can see things like the Glasgow Community Food Network, the Shetland Community Directory. We've done quite a lot of work with Shetland recently, and we're constantly trying to encourage people to use ALISS, because we believe that because we've got this national resource, people should use it, and they shouldn't spend money needlessly on their own things. Although they do that, and with the best of intentions. And what we would seek to do, I suppose, is to try and get as many people on board with ALISS as possible. I mentioned that NHS Inform integration, and then other people will take data. In the case of East Ayrshire and Renfrewshire HSCPs, they're taking data from NHS Inform, which includes ALISS data. And just a wee illustration of what the Food Network are doing. This is the forest of food and nutrition resources that are available in Glasgow. And you could do this for any area. I'm not sure you quite have the forest that you've got here, but that just illustrates, I suppose, the current situation with the need for food banks and these kind of resources. So you can do further searches, as you can see. You can click to filter it down, but that's an integration which people like, because people like that sort of visual interface. And I'd say watch this space, because we're going to be developing a generic version of this that people can use on their own websites. So you could, for example, pick a different area, pick a different category, and display ALISS entries on your own site if you wanted to. So we're working on that just now. Other ways to look at the data. We've recently developed an Alexa app, or an Alexa skill to give its proper name, and that's called My Scottish Community. So we have recently finished an Innovate UK funded project which did lots of things on ALISS. A lot of the features that I've been talking about have been improved, and one of the things that we built from scratch, or our industry partner built from scratch, was an Alexa skill. So so you can talk to ALISS. It's pretty transactional, as most of the Alexa skills are, but there's not a great deal in that health and wellbeing space on Alexa, and so we're keen to demonstrate what can be done. And so we've been working with a company called TL Tech on that, and they've helped us do that, but it is something that needs maintained, and there's a lot of ideas that come through. Just as we've got a big backlog for the website, we've got a big backlog for Alexa as well to improve things. Yep, so right, that's fine. Yes, so another one I wanted to mention was the artificial intelligence feature that we've had since January. It's a thing called Connecting You Now, which is built from a CivTech challenge. So NHS 24, Scottish Government Digital Health and Care, Scottish Government Digital Directorate all funded a CivTech challenge. The result of that was Connecting You Now. We put our hands up and said we would beta test it. So we have done that. About the first 3 months was an official beta test, which was relatively successful, and we've carried on with it. So it is an option now to talk in a more conversational way to ALISS using this sidebar which pops up, and we're going to be updating it. We're going to be removing the name Heather, which is one thing, and we're also going to be removing the references to it being a test as well, because we're now in a phase where it is almost production, level. But I think we have to be mindful of the, we're in the early stages of this stuff. People will probably know about AI hallucinations and things like that. But then, Google search algorithms are not perfect. Our search algorithms are certainly not perfect. So one has to, I suppose, be mindful of the fact that the results may not be 100%. But I think Connecting You Now has been developed with health and care in mind. Well, public services generally, but thinking about health and care, thinking about situations where, if somebody types in, "my house is burning down," you don't want to do an ALISS search for that. You want to be told to phone 999. These types of things, what we've called guardrails, which is basically accounting for situations where, stop this conversation and take emergency action. So referral to the Samaritans if someone's talking about suicide, self-harm, crime, these kind of things. So we've worked with Connecting You Now on that, and we're continuing to work with them. And what you might see in the future is more of an integration between, the ALISS front page search and the conversational side of things. But that's something that we're doing workshops on. We're doing lots of service design around that stuff at the moment. So yeah, as I say, it's always going to be evolving. Yeah, I think just to sort of finish off, I'll tell you what our strategic objectives are as a programme. So as I said, it's kind of like that split between the technical stuff and the non-technical. So we want more data on ALISS. We always know that we're not going to be complete, because there's always things starting up or shutting down. So we want more information about health and wellbeing resources to be on ALISS. We want better data, so we want that quality to be increased. We want a better experience, so we want the website to be improved, to be more accessible, to be more straightforward in terms of user journeys and stuff like that. We want more people to use it, so from a search point of view and from an adding point of view. And then in the middle there, this is a recently added objective, which is about insights, which is obviously things like analytics, but also giving policymakers insights as to what's going on in the sector nationwide. We feel that ALISS can really benefit in feeding back as to what's happening. So again, I could say lots more, but that's pretty much half my time, so I better move on. Moving on to the other programs within the Digital Hub, we've got the Digital Citizen Panel, we've got the Digital Links Project, Discover Digital, and the Human Rights Principles. So all of this is overseen by my colleague Louise Copeland, and she manages each of the different pieces of work. But I'll just run through them for you just now, because I think there's links to what I've already said about ALISS, but there's also lots to think about in terms of what's live in the digital health and care space. So first of all, Discover Digital, a project to raise awareness of digital tools and resources that can support health and wellbeing. There's going to be links in a future slide, and I'm going to supply the presentation. So, but there's more information on our website in summary about all of this. So we're doing roadshows and workshops, which is about taking devices, taking information out to communities. So where there are community events taking place, we have a roadshow offering. So we can show people on tablets, we can take Alexa out or whatever to people and show them not every health and wellbeing resource that's out there, because there's too many to do that. But we try and select the most trusted. We try and select the most credible ones, and with, I suppose, a nod to the Orca kind of repository and the work that people like Alzheimer's Scotland have done with Adam, their Adam project. Learning from what's working and taking that out to people, because people don't know about what's available. They don't know about Sleepio that can help you with your sleep. They don't know about things like Silver Cloud, which is a mental health tool. You know, these are NHS endorsed resources that people could benefit from, you know, if you have a device. And we'll come on to the digital inclusion thing in a minute. We've had a small grants programme, and I'll talk briefly about that. We've got a Discover Digital guide on the website, which is quite lengthy, but we've created some learning resources around that. And we do a thing on social media called Try a Tool Tuesday. So it's essentially talking about one different resource every Tuesday and encouraging people to try it out. And then the educational learning, and I'll speak about that in a minute. So these are the different projects that have received some funding from us due to constricting resources. The grant programme is not ongoing, but these are the sorts of things that we've been looking at. So I suppose I've got these in the wrong order. The discovery grants are really the ones about engagement, to find out about, you know, what the issues are. And then the enabler grants were to a bit more money, a bit more lengthy, to actually carry out some work. And you can see the different projects that we've funded there. There's more information, there's reports, there's videos and so on the website. This is where the links come through to the different bits on the website, but you can link through to the Discover Digital Open Learn Create course. We've got a SSSC Open badge. We're on the Right Decision service, and then you can learn more about the workshops and roadshows on the Alliance site as well. Digital Citizen Panel. So this is about engagement with people. And I think 129 members is a slightly out of date number. So I think we're maybe over 140 now. But this is individuals and organisations who are interested in the digital health and social care world. Not always advocates for. I think it's fair to say that people are quite sceptical. You know, they're always wanting to question. You know, we'll come on to this with human rights work around choice and non-digital options being available. But I'm listing there just a few of the things that we've done of late, which is helping with Scottish Government's Digital Front Door programme. If you haven't heard about that, it's about the creation of a single front door for health and social care. I suppose the most comparable thing in England is the NHS England app, but the ambition's bigger in Scotland. So that's stuff that we've been involved with, the service design around that. Digital prescribing and dispensing is something that we've supported as well, in terms of finding out what people's views are around that. Most recent piece of work has been around NHS Inform and people telling government what they think of NHS Inform, or the fact that, you know, in a lot of cases they don't know about NHS Inform, because what people are doing is they're Googling their symptoms and they're turning up the NHS UK website as opposed to NHS Inform. And what we're about to do is a bit of engagement around integrated care records. And so this supports some previous stuff that we did around the Scottish Government data strategy, but we'll be going into more detail, and hopefully we'll see, you know, some progress and something approaching an integrated care record sometime soon. There's more information on the website, including stuff about conversation cafes that we do monthly as well. So moving on, Digital Links project. It's really like a combination of Discover Digital that I've already talked about and link working, or social prescribing, I suppose. Although I'm sure my links colleagues would not like me to say that their social prescribing and links are the same, but they're in that space of non-medical alternatives when people are engaging with primary care largely. Although we do have some workers in food banks, and we've got some energy efficiency work going on, homelessness links workers, refugees and asylum seeker links workers. So there's quite a lot of diversity now within links, and we've diversified further by going into this digital space, because I think what we're seeing is that digital inclusion at the sort of headline level is, kind of quite, 90% or something like that. But when you go into marginalised communities, you're seeing those figures drop dramatically. And that's really what we're trying to address specifically in Glasgow with this Digital Links project. And so that's funded by Scottish Government from the Connecting to Care Fund, which is part of their digital inclusion programme. Again, more information on the website. Finally, and this could be that, if you take nothing away, maybe take the human rights principles away, because I think what we're trying to say is that you might have a device in your pocket at all times, but not everybody does. Not everyone can afford devices. Not everyone has data. Not everyone has things that are designed around them. So I suppose that's the first thing there about people at the centre. And I spoke about service design approaches and human-centred design, and I think that's really what people at the centre amounts to when we're in that digital arena. Digital where it's best suited. So that's not always going to be digital, is it? It's going to be in person or offline or analog. Sometimes people say alternatives to digital, but essentially, the in-person or the non-digital means are often the best. However, there can be significant benefits, as we know, of using digital, but it should be an ongoing choice. So in other words, people should be able to opt in and out if they want to, and shouldn't be disadvantaged for doing that. But with a lot of government agendas, we do see language like digital first. We see things like, well, we're going to turn off the old way of doing things, and I think we've got to be really careful, because we're leaving people behind. And I think lessons of the pandemic really have not necessarily been learned on that side of things. So digital inclusion, I think, I've spoken about devices and data. We're also thinking about training, training for individuals, training for staff as well in health and social care is really important, because, it takes two to tango when it comes to, a video call or using remote monitoring. The individual may know how to use it, but if the staff member at the other side doesn't, then it just doesn't work. And then finally, thinking about that records piece, access and control of personal data. We believe that people should have their own data at their fingertips. They should have control of that data. So they should be able to grant permissions. They should be able to use that data without having to, that request for records, that subject access request, which takes time and can cost money. Why in this day and age, have we not solved a lot of the issues? And people on the call will know, words like interoperability start to come into the equation. But really, we have the technology, don't we? It's about the politics and the information governance and the GDPR and all of these sorts of things. But again, I could talk more about that side of things. But I think, that what we're trying to do here with this piece of work is to say that human rights can, if we bring them into a digital field, we can say, well, it's about bringing these things to life. And, this is something that we want to review and we want to develop, because I think, we've not mentioned AI here, and I think we possibly should, these types of things. But that's an ongoing piece of work, which we do because human rights are intrinsic to the work that the Alliance does. So this is the final slide, and it's just with my contact details on there. Hopefully there's enough time for questions and so on. Happy to answer. Might be to refer you to somebody else, actually.
You know a man who can. That was a great run through, Chris. Really enjoyed it. It shows the breadth and depth of what the Alliance is doing in the digital realm. So I'm sure people, it's coming up in the chat. Very impressive. Wanted to ask what information has been. Just wanted to ask what information has been or is being used to train AI search assistant. So that will be your Ask Heather.
Yes.
That you showed.
Yeah, that's a really good question, because I think you know, when you're thinking about ChatGPT, for example, ChatGPT is being trained on the internet, isn't it? And that's a scary thing because we know what the internet can be like. And so one of the things with Connecting You Now and with Heather as it currently is that the AI is trained on the ALISS data set. Firstly, so I mentioned the open API. So the data comes from the API to Connecting You Now, and the AI is trained on that. Now, a lot of those entries have got URLs in them. So what the AI will do is it will go a stage further. So the second piece of the puzzle is to go to those third-party websites and to learn a bit more about what's on, what these services are. So the Connecting You Now system, excuse me, is a wee bit more than just what you would see with ALISS entries. So sometimes that's a good thing. Sometimes it turns up some interesting results because you know, the entry might be up to date, but the website isn't, or vice versa. So, but it doesn't go any further. It's only going to those third-party websites, not going further and on out into the wilds. So that's that. You know, I guess that's the training of the AI. And then there's various other sort of things you can do in terms of dialing up or down the empathy. You know, these sorts of things, and you know, we're seeing, it's slow, I've got to say, in terms of what we're learning from it. But I think it's just
I'm surprised by that.
Well, we started off with the numbers were really low, and then we switched it on to the automatically popping out, and that ran for a few months, but people didn't like it, so it doesn't automatically pop out anymore, which has slowed it back down again. But I think, as I said before, what we'll be doing is maybe a tighter integration, so you don't have that pop out issue. There's a journey.
But as Heather's learned more from on the development platform with the links provided, she'll start to be a bit smarter.
Yes. I'll touch on this just briefly, because we decided to remove Heather because we didn't want a female name, because lots of these assistants are female names, and a lot of people said, and I agree, that you know, it's that notion of an assistant being a female. So Alexa, obviously Siri, but you know, some of the user research that was done was favourable about Heather, but we felt, actually, do you need to call it something? Can you not just call it the ALISS Search Assistant or the ALISS Intelligent Assistant? Because we don't want people to actually think that they're dealing with a human. We want it to be quite clear that it is artificial intelligence.
Automated, yeah. What would you like the people who are on this call tonight, what would you like them to go and do? What do you want them to get involved in? How can they contribute towards ALISS and all things digital at the Alliance? Pick any question of the above.
Well, I think that, I suppose it depends, really. You know, there might be people on the call who've got, you know, sort of sparking ideas from a kind of technical point of view, and I'm always open to linking up. And you know, as I said, we've just finished an Innovate UK project, and whilst it did age me by a number of years, we got a lot of things done through that partnership, and through the resource that we could bring in through Innovate, and the networks that Innovate have got. You know, it was really good. So I'm always up for collaboration, And so that might be from a technical point of view, or it might be from a sort of more people point of view. It might be that you're interested in joining the Digital Citizen Panel. It might be you go on ALISS, you find that something's not there and you expect it to be there. So please do add it. Or you think, I'm managing a team and we could use ALISS, and so connect with us because we could train you to be ALISS editors. I didn't mention that very much. So there's stuff like that, or just go on. There might be or you're in an area and you think, oh well, we could really benefit from a Discover Digital event or roadshow. So there's a variety of things, or somebody in Glasgow who could benefit from the digital links work. Said he.
Delighted to say, Chris Hoy has added a great presentation, Chris. Fantastic progress. The original team would be so happy to see all the ideas around collaboration working so well. And the introduction of ALISS AI fits exactly with the original vision, which must be music to your ears. You're going the right direction, and you're hearing it from people who've been involved from the outset.
I'm mindful of the history of it. One thing I didn't mention was that we do have a 3-year roadmap. So we've done quite a comprehensive piece of work mapping out what we're going to be doing, which fits into these 5 strategic objectives that I talked about. So we're not resting on our laurels by any stretch, and I guess some of it's about alignment as well, because one of the things that people could do is link us into other initiatives, and because I talked about the landscape and the fact that there's lots of mapping work, there's lots of directories and stuff going on, and that's all good, but let's link it up, and maybe ALISS can be a focal point for work that or that you're doing. So that's another possibility.
And it's a really good clean interface, and you can find genuinely local services that are out there and communities to support you. So I'm sure people on the call have actually used it and they're being shy and not asking questions. So where's it going next? You've got a 3-year plan. How are you getting out and about to people? Is it more talks? Are you holding events?
Well, I guess it's that combination of the technical and the people side of things. What I might do is just flash up the roadmap. So that's the kind of overview.
Oh, great!
So you can see some of the big areas: more data, better data, better experience, more users,
partnerships,
better insights. So I was asked recently what non-functional requirements are. I think that's a lot of the.
And so, what did you say?
Well, I guess a lot of this stuff is about technical things, but you've got to have a lot of sort of plumbing. As people will know about, your hosting's got to be in place. You've got to have your cyber security thought of and planned for. So it's those things that don't necessarily contribute to what you see on the front end, but you've got to have an eye on. One of the things we did recently, I don't know if people are interested, that we did a complete rewrite of the system from the original Python code into C#.NET. We moved on to Azure. The database got moved from one of the SQL flavors into Microsoft SQL. So it's these kind of things that your data protection, your privacy policies. So things when you're looking at issues like personalization, for example, which is one of the things that we've been looking at, that brings with it consideration around use of personal data, and so you've got to be careful around that, but because it takes you into a different realm. Just scrolling down, this isn't going to be very clear, is it? That just shows you, and there's spreadsheets upon spreadsheets that sit behind all of this.
Yes. Plan on a page.
So that's showing you the sort of stuff that we're doing this year, and then some of the green things are the sort of more blue sky, could be things, and then the yellow things are more straightforward, as it says at the bottom, they're incremental.
Yeah. Amazing. So you're keeping busy.
Oh yes. Yeah.
Yeah. And well, you're keeping very busy, but you know, if these lovely people and whoever else watches the presentation afterwards, if they start coming forward with ideas and suggestions and look to collaborate, you're going to be even busier. So would the Alliance grow the digital team?
Yeah, well, I think there's 10 or 11 of us now. And you know, it's a very active space, and I think there's a lot of innovation, and my concern with that is that we can do a lot of, oh, look at this shiny thing, but it is about scale now. It's about, right, okay, so we've proved that lots of things can be done, but we need to reach communities. We need to get the benefit out to people, and the other thing, I suppose, is there is a bit of a postcode lottery with a lot of this stuff. You know, I'm involved with some of the Scottish Government digital maturity assessment work, and it is a very varied picture. Now, obviously, Scotland is a diverse country, geographically, population-wise, demographic-wise, etc. So there will be variances, but I do feel that when we talk about digital health and care, some people will go, ah, yes, I heard about that. I know where to go in my local area or for advice or where I can access this. Or you get somebody who says, well, I asked about that and I was told it wasn't available. You know, like a near me video call instead of traveling miles to a consultation. And that's what I meant earlier when I was talking about workforce as well, that if staff aren't on board and they're not offering things, then citizens are not getting their rights. They're not getting access to things. And it's not the only answer, but it is a big answer to a lot of challenges. You know, we're hearing about public finances again and the challenges there. And let's face it, you know, digital can be an answer to a lot of that stuff. Connecting You Now, for example, can bring services to people in a way that was not possible previously. And you know, these types of things, let's bring them to everyone.
Some more around that, building the digitally ready workforce. Oh, there's something else coming in. Oh, was it Christine shared a picture Derek used to answer questions. What does ALISS look like? Lion of Grimshaw, made by taxidermist who had never seen a lion. Oh my goodness, Christine. That's quite scary looking.
So I think I know what this is about, because
ALISS is friendly.
Well, I think that ALISS is not necessarily what I think it is or what anybody individually thinks it is. When you do that co-production process, you get something that's, you know, maybe not taxidermy, but kind of knitted together from lots of different pieces. And you know, I don't have I can tell you what the roadmap is, the objectives are, and so on, and I can recite the vision and stuff like that. But at the end of the day, you know, it's not just me as a leader that says this is what we're going to do. You know, my Scottish community, the ALISS app's a good example of that, which is we wanted the thing to be called ALISS, but we did user research, we did workshops, and it was like, well, you can't have it because some people say ALISS, some people say ALISS, some people say a local information system for Scotland, And then somebody came up with My Scottish Community, and we just thought, yeah, that's brilliant. That's it. That's what we're trying to
Simple.
do.
Yeah. Yeah. You've got a new admirer from Nicola who says, this is amazing. Reaching out into community in this way is critical. AI relies on good data quality, and I saw data quality as a green aspiration milestone. How confident are you in this regard?
More confident now than I was previously. We've got a lot of, we're doing some manual data cleansing. So there's a team member who identifies broken links through automatic tools, actually, but would go on and change things. And then we've got automatic emails going out to people now. So if the thing hasn't been reviewed in 10 months, you get a reminder. 11 months, you get another reminder, and then 12 months is when it gets moved down the search results. So no entries that are on there get removed, but there is a flag on them whereby they're, they're looked at in 12 months. And so even users of the API can see that. So even when you're doing your search results, the top entries now, there's other algorithms at play, but the ones that have been updated in the last 12 months will always appear at the top. So it's about our credibility, and as you say in the question, AI relies on good data quality, and that's, you're going to stand or fail on your data quality. And if you start building AI on top of shoddy data, then it's just that classic garbage in, garbage out, isn't it?
Yeah. I'm going to finish on a comment from Margaret, who says, many thanks for such an interesting presentation. And Chris, it really has been, and we really appreciate you taking the time. And thank you to everybody who's come along, and everybody who's registered will receive the slides and the recording, because Chris has made sure that you'll be able to get through to the links that are in the slides. So thank you very much, and enjoy the rest of your evening, folks. Get out there and get some sunshine. Thank you
Very much.